Anybody else want to testify? All right. Michael Bagan, MD, Texas Medical Association. Come on up, doctor. Dr. George Cole. Come on up, sir. All right. Is that an R or a B? Is it Reagan?
Reagan.
Okay. Dr. Reagan, go ahead.
Okay. Well, my name is Mike Reagan. I'm a family physician from Lubbock, Texas. Been in Texas all my life. Went to school through the Texas system. And I'm representing the 45,000 physicians and student members of the TMA. In particular, I sit on the TMA's Council on Medical Education, who deals with these issues you guys have been talking about today. And I am the immediate past chair of that group. And I've got a lot of data that you've already heard, so I don't want to wear you out with that. I think we have this document that you'll see, which is a summary of some of the data. I'm a department chair of family medicine at Tech. And so what you guys do here in Austin keeps me up at night because I worry about balancing the budget in my department. One of the challenges is that almost every revenue stream that we see in medical education is going to get cut. And that cumulative effect is tough. We are pretty tight. I would say, you could say we're running on fumes in terms of keeping things going. You've talked about the need to keep faculty to meet accreditation standards, and that's absolutely true. We have had to make the hard decisions and send people away who would still be with us if we had the funds, and I think we're going to see some more of that. There are some elements of this I think that are important. We're looking at about $1 less out of 4 that's spent on medical student education. We're looking at about $1 less out of 3 that's spent on resident education on average. And the finances of a department include all those sources to make it go. If you look at a faculty member's duties, they might be seeing patients at one point, later in the day, teaching students, later in the day, teaching residents, rotational kind of thing. We expect Medicaid will be cut as well, and that's a revenue funding stream. So it's going to be tough to make all that work. We sit with a workforce crisis today. There are really two things we look at on the council. One is education, the other is workforce. We're 42nd, I think, in the country in terms of doctors to population. Some areas are worse than others. Rural is certainly worse than others. Border's the worst, I think, in doctor to patient ratios. We have added students, 300 new students in the state over the last 5 years. 270 of those are Texans. There is a cap on the number of students we can accept outside of the state, no more than 10% of the class. So more Texans are attending school. We're very tight on residency spots, and that's dependent on federal funding. But we know that if a student trains in Texas, does residency in Texas, they're going to be very likely to stay in Texas and practice, about 80% in Texas. We set 4th in the nation in retention of our own trainees. So that's a record to be proud of. We hang on to a lot of those folks.
Well, Dr. Reagan?
Yes.
What do you want us to do?
You got to help us. We got some tight spots. Hospitals, and there was some discussion about hospitals and their support of trainees. I think that's applicable probably in Fort Worth. Primary care is not generally done mostly in the hospitals. So that funding is really critical. The state funding for primary care education, really critical. Coordinating board funds that help support that training. There's an example of a residency program in Houston, Kelsey-Seybold, Baylor, that closed. It closed because of financial challenges. And we've looked at that across the state, and it's very tight in primary care. We will likely see some of those programs be gone with some of the funding cuts.
So do I understand you want us to maintain or increase funding for primary care residencies? Is that what you're talking about?
That's an element of it. Keeping those residencies functional is a key piece.
All right. Anything else?
I think that hits the key points.
Okay. Dr. Reagan, go ahead.
One question. You said that the doctor-to-patient ratio is 42nd in the country.
That's right.
I think we got a little bump anyway after medical liability reform.
That's right.
But show me a curve. I mean, is it...
So 10 years ago, we were 41st in the country. Now we're 42nd. So it's pretty well flat. And part of the problem is population growth. Mm-hmm. We're really growing fast. We are adding docs, no question. Some of the licensure work that you did help sponsor was very helpful. I think liability was helpful, but we're still lagging.
Okay. Thank you.
All right. Well, thanks for being here all day.
Yeah.
And thanks for your testimony. All right, Dr. Cole.
Thank you. Senator Ogden, Senators, you've got a lot of patience. My name is George Cole. I'm an osteopathic physician. I'm an orthopedic surgeon in Dallas. I'm immediate past president of the Texas Osteopathic Medical Association. And I come before you today representing the osteopathic profession in Texas and to ask you to carefully consider two items that are in the LAR and one that is not. The first that is in the LAR is the request that you've already discussed for the $60 million in a new research building for the Health Science Center. The second, as we've discussed, concerns administrative expenses. And Senator Zaffarini has accurate numbers that I was going to present, but I want to give one more perspective about the President's salary.
Which health science center are you talking about?
I'm sorry, UNT, Health Science Center. All my discussion is about UNT. And the President's salary, as Dr. Ransom has said, as far as dollars, is in the range of the other Health Science Center presidents. However, if you consider a ratio of the dollar amount to the revenue of the institution, the UNT president salary is 0.425% of revenue of the institution, and that is 10 times higher than the ratio of any of the UT other than Tyler. Any of the major UT institutions. So the dollar amount is similar, but the ratio to revenue is not. The item that is not in this document is a request for the state subsidies or special items to underwrite the expected cost of the proposed allopathic medical school at the Health Science Center. 50 years ago, 3 osteopathic physicians in Fort Worth recognized that Texas medical schools were graduating very good doctors, but they were going into specialties. Those doctors recruited 100 others from all around the state who each pledged $1,000, which was real money in the 1960s, and that was the budget for the first year of the Texas College of Osteopathic Medicine. In the 1970s, the merger of UNT and TCUM happened, but the legislature in 2001 specifically forbade UNT from granting an allopathic or an MD degree. The Health Science Center hired Pricewaterhouse several years ago to do this study. They didn't ask, should we do it? They asked, how can we make it work? Pricewaterhouse believed so little in their credibility that they didn't sign the report. The Board of Regents of UNT recognized that this had not been signed by Pricewaterhouse and asked them to come back. They said, if the assumptions are correct, then this report is correct. We do not believe that the assumptions are correct because the study was done strictly on the campus there in spite of the reputation of Pricewaterhouse. A senior University of Texas executive recommended to us that we commission a study that would investigate the methods used by Pricewaterhouse and that would make a recommendation to TUMA as to further action, the Texas Osteopathic Medical Association. This experienced administrator suggested an independent firm that had been used by UT and by A&M in studying the possible cost for new schools in the Valley, in Round Rock, and in Austin. You have that document today. We just got it. Yes, sir.
I've read your testimony. Can you basically you're gonna summarize that you don't believe the Price Waterhouse report, you don't think that we should create an MD degree at the University of North Texas. It's gonna cost a lot more than they estimated, right?
The additional information that I put on there illustrates what we've already talked about. I would like to make one more reference.
You can make more than that. Just summarize your testimony and get it down to 3 or 4 bullets, because that's about all we're gonna remember.
I understand. The Texas Osteopathic Medical Association is against the current financial plan for developing the allopathic school at the University of North Texas Health Science Center because of the real-world comparisons of what medical schools cost today to start. Not the speculations of Price Waterhouse, but the real-world comparisons. We don't believe it can work.
Got that?
The only way they can make this work, if you allow them to change the law, if you let them do an MD degree, the only way they can finance it is by contributions from Fort Worth, which would be fine, another $100 million, or by taking resources out of Texas College of Osteopathic Medicine. That has already happened. We've lost 2 deans, countless faculty members, and now we've failed 8 students last year.
Okay. All right. Dr. Cole, thank you for your testimony, and thank you for your written testimony, because I'm sure we'll refer to that. All right. Mr. Gay, you testified the other day. You need to testify again. So you're going to pass? Thank you. Thank you. William Vaughn, general contractor for Vaughn Construction, had to leave. He got tired of waiting on us. He wanted to he had oral testimony. I think it had to do with UTMB and the construction down there. Oh, and he also submitted written testimony. Do we have it? All right. And the Alan McGraw, Mayor of Round Rock, is still in support of the Texas A&M Health Science Center in Round Rock, and probably still supports your TRBs, or Senator Zafrini. So after redistricting, maybe you can help them. Anything else? Anything else want to come before this committee? Anybody else need to testify? All right. We'll leave Senate Bill 1 pending. We'll recess those counties. Chair.